A quick trip to one of these Red Cross donation centres could literally help save lives. That's especially true this week, with the worst blood shortage in the country in more than a decade.
You go in, they ask you some questions, take a blood sample, make sure you're fit for doing it, and then what I did is they hook you up to a machine that separates out red blood cells and then puts everything else back in.
We've suffered from some personnel shortages before and some other capacity shortages, I'm afraid, and so I haven't been able to give every time that I've wanted to.
The American Red Cross supplies 40% of the nation's blood. Some centres are reporting they had less than 1 day's supply of critical blood types, which means they had to limit distribution of blood to hospitals. With not enough supplies, doctors have to make difficult decisions about which patients get blood transfusions over others. There are even reports of major trauma centres having to shut down temporarily while they wait for blood supplies.
You can't store it for a long amount of time. It expires. Some blood components like platelets can only be stored for 5 days. So you need a constant supply coming in without having manufacturing for that. So we all have to rely on individual donors to bring us the supply.
The coronavirus pandemic has led to fewer people donating blood. Some blood drives have been cancelled, and there's been staffing problems at others. The winter weather has made it worse. Well, the Red Cross has made a national plea to people to make appointments to donate both blood and plasma. They say it's urgently needed to treat patients who may otherwise have to go without critical care. Malone, CGTN, Fairfax, Virginia.